Namaste, everybody, and welcome to today's program on managing your blood glucose levels. And we'll be talking about hyperglycemia and diabetes. I apologize for the earlier technical difficulties that we were having, and we're happy to be back online and able to produce this program for you today. So I'd like to just begin with talking about how prevalent this condition is and what a challenge it is for our society. There are about 30 million people, that's just in the United States alone, that are suffering with diabetes. And diabetes is in excess of blood glucose levels. And in addition to that, there's another 84 million people in the United States with pre-diabetes. What pre-diabetes means is that your blood glucose levels are high, but they're not so high that it qualifies for diabetes. But people with pre-diabetes are on their way to diabetes if they're not careful and they don't learn what to do in order to manage their conditions. So today's program, my great hope is that it will help all of you, those of you with diabetes and hyperglycemia, to be able to manage your blood glucose levels better and not to experience the long-term complications of this condition. The long-term complications of not managing your blood sugar are very, very serious. High blood sugar levels, they do several things. So they're very well known to damage your arteries. So when they damage your arteries, what happens is you're more prone to atherosclerosis and arteriosclerosis, and this is a contributing factor of heart disease. So patients with hyperglycemia and diabetes, much higher levels of heart disease and vascular disease. And that vascular disease also affects the eyes. And so there's a greater incidence of blindness as individuals get older because their blood glucose levels are not being managed properly. And there's a greater incidence of stroke, greater incidence of kidney disease, because again, that can be a consequence of vascular problems in the kidney. And virtually anywhere in the body, the blood vessels are going to be compromised. And so there's a much greater morbidity, which means a level of suffering in individuals who are unable to manage their blood glucose levels properly. So this is a very, very important subject. It does get a lot of attention in the media, and I'm very happy about that. But unfortunately, things are not getting better. Things are getting worse in our society. And so while there's a lot of awareness out there, there's not a lot of paths for empowering individuals to manage their blood glucose levels. Ayurveda provides that type of an opportunity for individuals to take control over their blood glucose levels and to, as a result of that, to live lives that are so much healthier than they are right now. So let's talk about that. First of all, what's happening? What's happening when an individual is having a blood glucose problem? What's going on in the body? We have to understand that in order to best understand how to manage the condition. So blood glucose levels are primarily caused by two problems. One is that either an individual is not making enough insulin. Insulin is necessary to open up the doors or the gates, if you will, into the cells so that blood glucose can get into the cell and be utilized as energy. So if you're not making insulin, you're not opening up those doors, and the glucose can't go in the cell. And if it doesn't go in the cell, it accumulates in the arteries. And so you get a rise in your blood glucose levels, even though the cells don't have enough glucose in them. So your cells are starving for glucose. Meanwhile, there's plenty in your blood. Okay, and that amount in your blood is causing damage. Now, the second problem that occurs that causes these blood sugar problems is that you're making enough glucose, but the door is broken. And so even though the glucose is there trying to open up the door won't open up to the cells. And so the cells are not responding to the glucose. And again, the cells are starving while there's so much glucose that's going to be in your bloodstream. So these are the two problems. In medicine, when the main problem is your insulin is not being secreted, sometimes that's called type 1 diabetes. It's also called insulin-dependent diabetes mellitus. And that's because you're dependent upon taking insulin in order to manage your blood glucose levels. The other type is called type 2, and it's when the door doesn't open and the blood glucose levels rise. The door to the cell doesn't open. And so this is called type 2 diabetes, or non-insulin dependent diabetes mellitus. So we have really two different conditions in people. And it's important to understand the differences between them, because how they're managed is also somewhat different to each other. Now, glucose balance is also a function of some other organs in your body. And one other organ is going to be your liver. Your liver plays a role in storing excess blood sugar in the form of glycogen. And so this is stored in the liver, and it's good that it is, because if you don't eat for a long period of time, your body will break down that glycogen in your liver in order to produce more blood glucose, raise your blood glucose levels up. Because you do want to have enough blood glucose. In fact, your brain depends upon blood glucose. And so if you're not getting enough blood glucose, you start feeling foggy. You go into a hypoglycemic state, and you can't think straight. Too much or too little blood sugar is going to be a problem for your body as well as for your brain. And so we want to keep our blood glucose levels within a normal range. So if the pancreas is damaged, that's what causes the problem with insulin. If you have liver disease, that'll cause a problem with the stored glycogen. And these are the two main organs that we're concerned about in hyperglycemia. Now, there are other conditions that can contribute. If you have hormonal issues, there are certain hormones like growth hormone in the body that also affect your blood glucose levels. And so if you have any other secondary conditions in your body, that can also be a contributing factor to hyperglycemia. So sometimes individuals have more, I don't want to say more serious because this is serious, but other serious conditions in their body that are going to be contributing factors to your blood sugar levels going up too high. Some people are taking medications as well, like cortisol or cortisone and prednisone. Other types of glucocorticoid drugs that are also going to interfere with their blood glucose levels. We see this a lot in people who are getting older, who are on so many medications in their 70s and 80s. Their blood glucose levels often becomes a problem, not because they actually have a traditional form of diabetes, but it's a complication of taking so many drugs. Some pregnant women also develop blood sugar abnormalities called gestational diabetes. This tends to be transient. However, if you're a woman that has had gestational diabetes, you can think of that similar to pre-diabetes, because it does mean that you're at a higher risk of developing diabetes later. So these are some of the factors that are involved in physiologically what's going on in your body. Now, there are some factors too that are going to increase your risk of developing this. One of them is being overweight. This is what most people are aware of. Individuals who are overweight develop the type of diabetes that is the type 2 diabetes, where the door to the cell is broken. So the door won't open up, and therefore the glucose levels, the blood sugar levels, rise in the blood. So people who are overweight are prone, this is a big risk factor, are prone to type 2 diabetes, or non-insulin dependent diabetes mellitus. And the more overweight you are, the more at risk you are of developing these blood sugar problems. How big of a problem is this? Well, it's an enormous problem. 36%, approximately 36% of our population is considered to be obese. Obese is having a body mass index of over 30. You can just go online, you can Google body mass index, put in your height and weight, and you can learn what your body mass index is. But if it's over 30, you're experiencing obesity. If it's over 25, you're experiencing being overweight. 36% of the US population, the adult population, is obese. And our children are obese as well. It's a huge issue for our country. In addition to that, another approximately 34-35% are overweight. So when we add that up, around 70% of the population in the United States is overweight or obese. So this is a very, very serious problem, and that's why diabetes is in the news all the time, and why it's such a big issue. And we hear about it. We hear about it with our children, and we hear about it with adults. Now, If you have a family history of diabetes, you're also going to be at risk of developing it yourself. So if you know that you have a family member that has high blood sugar levels or diabetes, this should be enormous motivation for you to start now preventing, living the kind of lifestyle and diet that prevents blood sugar problems. Let that be a motivational factor for you, because you don't have to get diabetes mellitus. All right. If you have problems with your lipid levels or cholesterol levels in your body, chances this increases your risk as well. All right, a lot of people are on statin drugs. If you're on statin drugs, it means that you have cholesterol levels or lipid levels that are too high. You're already at a higher risk. Let that motivate you to take control over your life. Again, you don't have to get diabetes mellitus, have the blood sugar levels. You don't have to have the consequences of heart disease as a result of that. Also, certain hormonal problems, I mentioned before, hormones increase your risk as well. Let that motivate you as well. If you have polycystic ovarian syndrome, this is a hormonal issue that also increases your risk of diabetes. If you have Cushing's disease, if you have acromegaly, these are all conditions that will increase your risk. So again, let these risk factors motivate you to take even better care of yourself, because this is a condition that is really under your control. All right. So with that in mind, let's begin to explore it a little bit more deeply and look at things that you can do. Question came in, is it the same in men and women? Yeah, this occurs in both men and women pretty equally. And so this is something that both men and women need to pay great attention to. All right, so what are the warning signs of developing diabetes mellitus? How do you know if you have a blood sugar level that's too high? Well, of course you'll know if you get a urine analysis or you get your blood tested, because that's how you're going to find out exactly what's going on in you. Good news is these are very non-invasive tests. They're very easy to do. They're extremely safe. You can go to your doctor. You can get these blood glucose levels checked, and you'll know right away. But most people don't go to the doctor unless they feel like there's some reason or they feel like there's something wrong. Well, I would first of all suggest to you that if you're in that obese category, you should be checked every year. All right. Now, even if you're not in that category, what are the early symptoms of diabetes mellitus or high blood glucose levels? Well, a couple things you might notice. The first is that you might be extra thirsty, all right, because blood glucose levels when they rise, cause you to urinate more. Well, so that's your second one. You're going to be thirsty and you're going to be urinating more. Urinating more makes you thirsty. So if you're urinating often and you're at a high risk factor, high risk group for diabetes mellitus, then you definitely want to be checked out. You may notice that you're urinating more during the day, but you also might be getting up to urinate more often at night. Now, there's a lot of reasons why people might get up to urinate at night. A lot of reasons why people might urinate more during the day. They're not always due to diabetes or to hyperglycemia, all right? But it is a good reason to be checked and to find out what the cause of it is, especially if you're in one of those high-risk groups. You also might be very hungry. Remember I said that the cells are not getting enough blood glucose, so the cells are communicating that they're starving, even though they're in a sea of sugar. The cells need sugar in order to function, all right, and function well. So they start sending out signals, hey, go eat some more. We need blood sugar. Meanwhile, they're in a sea of blood sugar. So you're going to feel like you're hungrier, and that's going to contribute more to weight gain as well. So these are the main factors: excess thirst, excess urination, and excess hunger. Let these be warning signs to you that you might have a blood glucose problem, and then let that motivate you to take even greater care of yourself. Now, to prevent diabetes mellitus, there's a couple of things that you can do. Of course, you can lose weight. That's going to help you, and you can exercise more. Exercise is really interesting because exercise forces those doors open for a temporary period of time while you're exercising. I want to say that again because it's so important. Exercise forces the doors open so that the glucose goes from your blood into your cell. It only happens while you're exercising and a little while after that. So it's going to help lower your blood glucose levels, and that's going to be really helpful. So A regular exercise routine and losing weight, of course, the exercise helps you to lose weight, is a great way to help you to manage your diabetes. Now, or hyperglycemia. I do want to mention that in Ayurveda, awareness of diabetes has been around for thousands of years. And it was identified in the ancient classical textbooks of Ayurveda as a condition that caused excessive urination. And the word for that is prameha. So prameha is the Ayurvedic term for all conditions that cause excessive urination. Now, not all conditions that cause excessive urination are due to diabetes and hyperglycemia. All right, so what is called type 1 diabetes or insulin-dependent diabetes in Ayurvedic terminology is madhumeha, which means sweet urine. And this, however, is a Vata type diabetes mellitus. Now, in Vata type diabetes mellitus, an individual does not need to be overweight. When they have the Vata type diabetes mellitus, this is insulin dependent. This is type 1 diabetes, and it actually happens in individuals who are thin. Now, yes, you could be moderate weight and you can be overweight and still have type 1 diabetes. All right, but that's because it's still a Vata condition, but Vata is a little more complicated. I'm going to tell you about that in just a moment. But I want you to know that from an Ayurvedic perspective, madhumeha is type 1 insulin-dependent diabetes mellitus. And this was talked about extensively in the Ayurvedic texts. Now, type 2 diabetes that we kind of inflicted upon ourselves by living a lifestyle that is disharmonious, causing us to gain weight and causing those doors to get blocked from opening. And this is called iksumeha. And iksumeha is type 2 diabetes in the classical texts. And there is a complete protocol to follow identified in the classical text in order to manage this condition. So I'm going to be sharing elements of that with you. Now, this is a Kapha type condition. So there's a Vata type diabetes mellitus and a Kapha type diabetes mellitus. Type 1 diabetes, insulin dependent, is Vata type. Type 2 diabetes, non-insulin dependent, is Kapha type. Now, with that in mind, I want to let you know that Vata is a very tricky dosha because Vata can push the other doshas out of balance. So when a person has a Vata imbalance, some individuals are going to become thin, but other individuals are going to become heavy because Vata can push Kapha out of balance. And so an individual can be heavy, have Vata type diabetes, and wonder, why is my condition insulin dependent? So an Ayurvedic doctor or practitioner has to do a full and thorough evaluation on you to understand the way in which the doshas are interacting to determine whether or not this is due to Vata, Kapha, or Vata pushing Kapha out of balance. Here's another factor that's talked about in the texts. Kapha can block any process in your body. And so when Kapha accumulates and is not managed properly, type 2 diabetes, it can actually convert, according to Ayurvedic texts, to type 1 diabetes. So it can start out as a problem with blood glucose levels looking like type 2 and then become insulin dependent over a longer period of time. So it seems almost like a delayed insulin dependent diabetes mellitus. So as you can see, it gets a little bit complicated, and that's why it's important if you're having blood glucose levels to take control of your life, but work with an Ayurvedic practitioner or an Ayurvedic doctor, work closely with them so that they are able to help you to know what kind of diabetes you have from a Western perspective, what kind of diabetes or blood glucose level challenge you have from an Ayurvedic perspective, and then put together a proper treatment plan for you to be able to manage your condition. Because again, I want to emphasize you absolutely can manage your blood glucose levels. And let's talk about how to do that now. So the first thing that I want to mention is about the diet. Now, if you're listening to this, you probably know that in Ayurveda, we have dosha-specific diets. I wrote a book called Healing Your Life, Lessons on the Path of Ayurveda. And in that book, and in many other books that have been written that are out in the market, you can read about the proper foods to eat to bring balance to Vata dosha, to Pitta dosha, to Kapha dosha. And I want to recommend that you learn more about Ayurveda if you are a patient, and read one of these popular books on Ayurvedic medicine to give you more knowledge and more inspiration. Now, a few foods are essential to know to avoid when you have diabetes mellitus, especially type 2 ixumeha. All right, this is the kapha type. So you're on a kapha reducing program. And by the way, this kapha type diabetes is the type of diabetes where we are most effective treating it. And I want to emphasize that. We're most effective treating kapha type diabetes mellitus. This is true both in Western medicine and in Ayurvedic medicine. All right. Type 1 madhumeha, insulin dependent, where the pancreas is damaged and not producing insulin, is the most difficult to treat. It's the most difficult to treat. All right. So with that in mind, how do you treat this kapha type? A few foods, first of all, to avoid. Then we'll talk about what to have. But I want you to avoid, of course, you know this, I want you to avoid simple sugars and sweets. Everybody knows that. Candies, sugars, ice cream, cookies, junk food that has a lot of sugar in it. But I want you to start reading the labels of food, and I want you to start looking at the added sugar that is in the food that you eat. And wherever it says the added sugar, I want you to start paying attention to it. Sometimes you'll see a very small amount, and sometimes you'll see a very large amount. So if there's a lot of added sugar, for instance, if you were having soy milk, all right, and you were having vanilla soy milk, and you looked at the label, you'd see a large amount of added sugar into your soy milk. On the other hand, there's unsweetened soy milk. So people don't think of soy milk as a source of sugar for them, but it is. And that's true of oat milk, and that's true of almond milk. And so you have to read the labels. Start learning what foods have a lot of added sugar in them. Now, in addition to that, avoid white flour. White flour will raise your blood sugar levels very quickly. All the flours have a lot of naturally occurring sugar in them. But because of the processing of the flour, that sugar is processed very quickly. And so it quickly raises your blood glucose levels, and your body can't manage that. So you want to stay with whole grains, and you want to avoid all the processed grains, and now you want to also avoid all the added sugars in the foods that you're eating. Now, if you're diabetic, you even have to avoid the natural sugars that are in fruits that have high sugar levels, things like that. But if you're pre-diabetic, just focus on getting rid of those added sugars, all right, and all of those simple sugars that are in the sweets. Now, in addition to that, Ayurveda teaches that it's important to avoid alcohol. Particularly, Ayurveda mentions beer, because you've seen people with beer bellies, and you start drinking beer, and you drink a little bit more and a little bit more. It becomes a routine, and your body starts gaining weight as a result of the beer. So most people don't drink enough hard liquor to gain weight, but they do drink enough beer to gain weight. I'm not suggesting you switch from beer to hard liquor. In fact, it's better for your entire body if you just avoid the alcohol entirely. It's better for your blood glucose levels. It's going to be better for every physiological process in your body if you do that, okay? But really, if you're a beer drinker, that is what you would want to stop. In addition to that, avoiding meat is going to reduce the heavy quality in your body. Now, if you become a vegetarian, generally people will lose weight, and that's very helpful. If you don't lose weight if it's a vegetarian, if all you eat is pizza, white flour and cheese, all right? So you've got to eat a lot of vegetables. We'll talk about what to eat in a moment. Dairy should be reduced, and yogurt should be reduced, particularly the thick dairy, which is the yogurt. Milk is okay, but the yogurt is going to be too thick in order to take, too heavy, too dense, and it increases those qualities in your life, in your body. So you want to avoid that. So this gives you a good idea of what not to eat. What should you eat? Well, this is probably the most important takeaway that I'm going to tell you. All right, when it comes to your blood glucose level, bitter taste lowers your blood glucose level. That's right. If you have bitter foods, they are natural medicines for your blood glucose level. They swing the door open in the cell. That's right. So if you have bitter foods, which you find in, for instance, greens, many of your greens have a bitter quality in them. So if you have dandelion leaves, even some of the pungent ones also have some bitterness to them as well, like arugula, and of course spinach is bitter, and kale is bitter. All these bitter leafy greens, commit yourself to a salad or two every day. Make sure you have a green salad at lunch and a green salad at dinner. Think about that as antidoting the glucose problem that you're having in your body. It's medicine. Think about it as medicine. A big green salad, take that in. Now, if you put a lot of oil on that salad, that's not what I'm talking about. That's going to cause your weight to go up. Learn to enjoy it with a very, very light amount of dressing on the salad. But the bitter taste is wonderful. A lot of people have become enamored with bitter melon, which you can get in Asian grocery stores. Bitter melon having a strong amount of that bitter quality to it, and special actions. Actually is a medicine we use in Ayurveda for lowering blood glucose levels. And so you can take bitter melon in small amounts throughout the day, and that's like a medicine also for your blood glucose levels. If you're diabetic, you're measuring your blood glucose levels on a regular basis so you can see where it is and make sure that your blood glucose levels do not dip too low, because these are strong medicines, all right? I'll talk about a couple of more medicines in just a moment, but those fall under the foods. You want to take more bitters into your diet and less sweets into your diet. In fact, you can manage your glucose levels entirely that way. If you just do those changes in diet that I've just mentioned, you might not have to do anything else, because you're going to see tremendous results. Now, lifestyle is very important. Here I want to talk about how Vata and Kapha mix together as well. First, we'll start with the Kapha. Of course, if it's a pure Kapha type blood glucose issue, then you have to become more active. You've got to exercise more. You want to sit less, walk more. And so go for walks throughout the day. If you have a sedentary job, make sure you take 10 minutes every hour to walk around and manage your blood glucose levels. This becomes a medicine for you. Take a long walk in the morning or a long walk in the evening for 30 to 45 minutes every day. This is going to do wonders for your overall health and your blood glucose levels. Of course, it helps your heart, it helps your mind, it helps your emotional attitude as well. So it has so many benefits to exercise regularly. You don't necessarily have to go to the gym and do a heavy workout. That's intimidating for a lot of people. Just go for a walk. Get off the couch. Stop playing video games. Stop watching TV. Stop watching movies. This is going to help you tremendously. All right? Get some exercise. Take a yoga class. Yoga class gives you a double benefit because it also relaxes your body. So let's talk about Vata for a moment. Vata is related to the type 1 diabetes, right? But I said that Vata can push Kapha, and a person can have a Vata imbalance and become very overweight. Now, this is a Vata-Kapha combination imbalance, but the root is in the Vata dosha. In these individuals, it's very important to exercise. Yes, you have to lose the weight, but you really have to manage that Vata dosha. And the way you do that is by developing regular routines, making sure that you wake up and that you go to sleep at the same time every day, making sure that you eat at the same time every day. And in addition to that, and I'm going to tell you, this is one of the most important things that not enough people know about, you have to get enough rest when you're Vata. Rest, just a moment ago, I said you have to exercise more, you've got to do more. When you have a Vata imbalance, you have to rest. Now, it doesn't mean to rest on the couch necessarily and eat and gain weight. When I talk about rest, I mean a real deep rest for your body and for your mind. Studies show that rest is essential to managing your blood glucose levels. Individuals who rest well do much better managing their glucose levels than individuals who do not. So with that in mind, Ayurveda recommends Yoga Nidra as a practice. Yoga Nidra is a conscious practice of deep relaxation. It's not sleep. It's not ordinary sleep. In fact, if you fall asleep, you are absolutely not doing Yoga Nidra. Yoga Nidra is a way of being consciously awake and relaxed at the same time. It is a beautiful practice. I produced a recording called Yoga Nidra and Self-Healing. There's many other ones on the market as well. You can also go on YouTube and you can listen to my CD or my recording and take yourself through this 45-minute practice. Studies have been done that show specifically on blood glucose levels that if you do yoga nidra and you take your medication for diabetes, your blood glucose levels will be better managed than if you take your medication alone. So yoga nidra boosts up the effectiveness of any medication you're taking. Now we'll talk about herbal medications in a minute, and it applies to that as well. Okay, so you're going to do better if you're practicing yoga nidra. It should absolutely be a part of every patient, their protocol. Yoga nidra is more than just deep conscious relaxation. It's also conscious creation. More about that in another video about yoga nidra. Or go on YouTube and look up my videos on yoga nidra and you'll learn more about that. But it's a beautiful, beautiful practice and I highly recommend it. All right. So you're going to be, if you follow the diet, you take those bitter herbs and you avoid those sweets and you're practicing yoga nidra and you're following a proper daily routine where you're getting up at the same time, going to bed at the same time, and eating at the same times every day, that is really going to do a tremendous amount to manage your blood glucose levels. Now, in addition to that, you have to sleep well. You do have to sleep well. And so sleeping well is essential to managing your blood glucose levels, particularly if you have a Vata type diabetes mellitus, which means insulin dependent, or Vata pushed the kapha out of balance, and that caused non-insulin dependent diabetes mellitus. So managing insomnia becomes a part of managing glucose levels. Your Ayurvedic doctor or practitioner can help you with that. I recommend you get into a regular program so that you get the proper support that you need, because managing insomnia is now another practice, or another protocol in addition to managing the blood glucose levels. It's very hard to manage your blood glucose levels if you're not going to sleep well and you're not doing getting the proper rest throughout the day, like through a practice of yoga nidra. All right, so all of that is really essential to you. Now, I want to mention just a couple of herbs that I think are important. Your Ayurvedic doctors and your clinical specialists are going to recommend you certain herbs to take. I really want you to take these herbs because a lot of research has been done on them, and they really do work. They really do work. These are great medicines for lowering blood glucose levels. Now, I really want you to get them from your Ayurvedic doctor or practitioner rather than going to the health food store and just picking up the individual medicine, because your doctor or practitioner is going to give you these herbs in a formulation. And the formulation is the best way in order to get the results in your body. But if you don't have an Ayurvedic practitioner near you and you're going to the health food store, you can get some of these herbs sometimes in the health food store. One of them is called Gurmar, all right, or Gymnia sylvestre. Gurmar does a beautiful job at lowering blood glucose levels, and you can work with that. You take it regularly throughout the course of the day in a capsule form, and this is going to make it easier for you to manage your blood glucose levels. There's another one called Saptaranga or Bijak, and this is a beautiful herb, also lowers your blood glucose level. In fact, sometimes wooden cups are made out of the wood because it comes from a heartwood. And so wooden cups are made out of the wood, and then the cups are filled with water and left overnight next to the bed. Then you drink the water. You drink the water during the morning, and you can drink it again at night before you go to sleep, and this helps you tremendously to lower your blood glucose levels. So you can get a Bijak wood cup, and you can start that practice, and you can also be taking the Gurmar. There's other herbs too, like Shilajit and other strong bitter herbs like Geduchi or Neem, particularly, that will support lowering your blood glucose levels. And these are often mixed together into formulations that are going to be prepared for you. Now, they're different if you have Kapha type versus Vata type. And again, if you've got that insulin dependent, you're really going to have to be managed closely. Depending upon how developed it is, it may not even be curable. All right. But early type 1 diabetes and type 2 diabetes are absolutely curable. And so if you do the things that people do who manage their blood glucose level properly, you'll be able to manage your blood glucose levels properly as well. All right. I see Dr. Heraldus on the feed coming in from Instagram. This is on Instagram and on Facebook. Is recommending the same herbs like bijak and shilajit and saptarangadi. And so these are wonderful, wonderful herbs. And so you can utilize these herbs. Okay, so I strongly recommend that. Now, we've had a couple of questions come in, and we'll end with just a couple of questions. So the first is, what is the role of simple carbs in diabetics? Well, the role is that a simple carb is a sugar. A simple carb is a sugar. And the simple carbs raise your blood glucose levels rapidly. And when they rapidly raise your blood glucose levels, this can create problems for you. Your glucose levels run too high. Not only is it going to damage your arteries, and I've talked about that already, that causes kidney disease, eye disease, heart disease, disease in the brain, increases your risk of stroke, but it also changes the way in which cognition occurs. And so you can start getting disoriented from it. If it got too high, you could go into a coma from it. And so it could be very serious. So same thing if you get too low. And so you really want to watch that significantly, all right? You really want to be careful with your overall blood glucose level. So a simple carb is like a sugar. It raises the blood glucose levels rapidly and causes more of the complications. So they should absolutely be avoided. Remember, complex carbs are whole grains. Whole grains are complex carbs. So if you're going to have spaghetti, let it be a whole grain spaghetti. If you're going to have bread, let it be a whole grain bread. But remember, they still increase kapha dosha. Ayurveda would say, go even further with this and just don't have that. Just don't have that. That'll help you lose more weight. All right, you'll lose weight more quickly and be healthier as a result of not even having those complex carbs. But everybody's going to have a little bit, so it's about having the right amount. About having the right amount. Okay. How do you know what blood sugar level is right for you? You'll be able to talk to your doctor about that, and there's a range of blood sugar level that is considered normal and healthy in individuals. And you can also go online, you can look these things up. When you get your blood tests, you're going to get the results back, and you're going to show the normal range, and then it's going to show if it's above or if it's below. So that's very easy to do. You've got to get a blood test, though. So you get a blood test, and you get that checked. Now, you can also check from the urine. If your blood glucose level goes too high, your kidneys are going to try to get rid of it. And so you'll start having sugar in your urine. And when you have sugar in the urine, that means your blood glucose levels are too high. Normally, you shouldn't have any sugar in your urine. So a simple urine test, in fact, you don't even have to go to a doctor. You can go to your drugstore here or pharmacy here in the United States, not all countries, but you can go there and you can get a little dipstick and just stick it in your urine. You urinate into a cup, you dip it in, and then you can see on the dipstick whether your blood glucose levels are going to be high enough. Are too high. And if they're too high, then you're going to want to lower it. All right. Now, I'm seeing a comment. Some Ayurvedic doctors don't believe in blood tests. Most do, and will recommend blood tests for you because you can get an objective measurement of it. Traditionally, it's really very interesting how this was diagnosed. It was noticed, it's kind of a funny story, it was noticed that ants would migrate to an area where a person urinated. This is a long time ago. But if ants migrated to a place where an individual urinated, that told the Ayurvedic doctor that there was diabetes that was present because, or this madhumeha or iksumeha. So this was part of it. Of course, you can also make the diagnosis based on the symptomatic presentation that a person is having, too much urination and too much thirst and all of these different things. And this is all part of it. So with that in mind, I want to encourage you, if you are at high risk of diabetes mellitus, you have pre-diabetes or hyperglycemia, step one, go get an Ayurvedic evaluation. All right, step one, go get an Ayurvedic evaluation. That Ayurvedic evaluation should understand your risk factors, called nidana, should understand what's going wrong in your body. This is called sympropathy or the pathogenesis of your condition. And then they're going to put together a treatment plan, chikitsa, in order to help you to get well. That's going to involve diet, lifestyle, and herbs. All right, so this is going to be very important. And once you've had your Ayurvedic evaluation, then work with your Ayurvedic practitioner regularly, because their role should not simply be to tell you what to do. Their role should be to support you to be successful implementing it into your life. And that's essential to being a good Ayurvedic practitioner, and it's essential to being a good, whether you're an Ayurvedic counselor or an Ayurvedic doctor, that kind of support patients need. This is really what makes Ayurveda so beautiful and so unique. I also want to let you know about a couple of events that are coming up. I just got one more question. What herbs are recommended for hypoglycemia? Oh, I see. That's low blood glucose levels. Well, this is different. And we're going to have to do a whole program just on hypoglycemia, because there are many causes of hypoglycemia, reasons why blood sugar levels will get to be too low. One of those causes is if you have hyperglycemia and you take too much medication or too many herbs, mixing them together too much, and you're exercising and you can push your blood glucose levels down too much. But some people have hypoglycemia for other reasons that have to do with stress, that have to do with other physiological problems in the body, and how each of those is treated is different. So I don't have time to go into that today, but we'll do another program just on hypoglycemia. So I want to let you know about a couple of other things that are going to be happening, and you might want to participate in them. One of them is going to be that we have a workshop coming up on Ayurvedic massage and bliss therapies, which is Shirodhara and Swedana, which is an herbal steam therapy. That's coming up here December 2nd to 7th, and I'll be teaching that program along with my team of assistants. And you can become fully trained to offer those in your spa or in your practices. We also have a Yoga Nidra retreat coming up in February that I'll be leading along with Dr. Jaya. And we lead these retreats from time to time. This will be at the Integral Yoga Institute in San Francisco. And that is on February 29th to March 1st. And we'll be doing lots of Yoga Nidra and talking about its history and its mythology as well. So it's a mini retreat. We'll also do a full Yoga Nidra teacher training that comes up. I do that several times a year. I've also certified other teachers that are offering CCA Yoga Nidra training programs around the country. And so you can look on our website about those. But I have one coming up with Dr. Jaya on March 28th to April 1st. And that'll be in the Bahamas, and that'll be at the Shivananda Yoga Retreat Center, and you're welcome to join me there. There's other programs coming up all the time, and you're welcome to go on our Facebook groups and on our website and take a look at all of those. I want to thank you so much for taking the time to watch this video. It is my great hope that through public awareness of Ayurveda, through public awareness of how to take care of yourself, that this work will make a difference in your life, make a difference in the lives of the people in your community, and that together we're able to make a difference in the health and the well-being of our planet. Many blessings to you as you go on this healing journey. I want to end with a short chant. We chant in Ayurveda to connect us together through vibrations, and also to connect us with the divine. And so it is said that through our connection to the divine, we're able to better control our senses, which means make healthier choices in our lives. So I'm just going to chant a very, very simple mantra, and this is a mantra for freeing yourself up so that you are able to make the changes in your life that are necessary. It's called the Mahabharata Jaya mantra. Om Trambakam Yajamahe Sugandhim Pushtivardhanam Urvarukamivabantanan Mrityo Mukshiyamamrutat. Om Shanti Shanti Shanti. Om Peace, Peace, Peace. Namaste, everybody. Have yourself a beautiful day, beautiful evening, and may you be well.